There's my girl right there. Oh, God.
Little mama.
What's that, little mama? Tell her we're running.
Huh? $10. I don't have any money. She just laughs at it.
Little Mama, she's a local who can almost always be found on 7th Avenue.
Hey, you doing all right?
Yeah.
You behaving yourself? You being good? Yeah.
She's one of those people you just try to help, try to give her a couple dollars here and there, encourage her to stay out of trouble.
You safe? You doing good? You got a place to stay tonight?
I'm not worried about it. I'll wait till next Wednesday.
Yeah?
Yeah.
Listen, we gotta get out of here. You behave yourself, okay? And be safe, all right? Behave yourself, okay?
She's just kind of somebody that we've adopted.
I can't help but love her.
She goes, hey, I need $10.
I know.
Like, what? She goes,
That last time
at least 5.
Seen ALS for rapid heart rate acknowledged.
Rescue 4 responded.
Engine 4 is calling for us to check out a patient who has a rapid heart rate after being attacked in Ybor City.
Rescue 4's on scene. What's up?
Heart rate's cranking at 160. But he was here hanging out, offered money for sex. He said no, so they beat him up.
Where's your shirt, man?
They ripped it off me. I don't want sex. They got mad. I was jumped at all of them. I was kicked in the back. That's how I went down. They were like, you're a My homeless lady helped me.
Little Mama? The real small girl?
Yeah.
Yeah, it's Little Mama. I know her.
Help me.
Little Mama saved the day. I'll be dang.
I'm gonna put this around your head real quick, all right? It's just oxygen. It's gonna help you breathe a little bit better, all right?
Right now, you get a pretty fast heart rate, so just try to relax a little bit, take some deep breaths.
We want to go through his vital signs, make sure that he's stable. He does have a high heart rate in the 150s.
Rescue 4. Transport 1 patient.
We do need to ask him about drug use. We're not trying to embarrass him or make him feel ashamed, but we need to make sure he's not having a cardiac episode.
You guys are trying to rape me. Can I do anything
I'm
about that?
I can't do anything about a police report or anything like that, but we can get you set up to where you could talk to somebody who can do something about it, all right? But right now, I'm just worried about your heart rate. Take some deep breaths, nice, slow, nice and easy. You have any other recreational drugs tonight?
No.
Any chance that you were spiked, drugged, anything like that?
No. I didn't take it in the club.
At this point, we're recognizing that he's going through a traumatic situation, and that's why his heart rate is elevated. Anxiety can do that. My main objective is just to calm him down, get the heart rate down.
Embarrassing to talk about.
Okay.
Well, just traumatized that you know. I
Yeah.
know these
Just take some deep breaths, nice, slow, nice and easy.
In through your nose, out through your mouth, right? Nice deep breaths.
We're pulling in now, okay, buddy? You need to file the report and get a no contact order, get a restraining order on him.
I admire him for not being afraid to file a report against his attackers.
It'll be all right, man.
A lot of people do not want to press charges when these things happen.
Your heart rate's slowing down a little bit, so that's good. Your blood pressure's down, so just calming down a little bit's helping you out there.
Prognosis is pretty good. He does have a few bumps and bruises. Physically, he's going to be okay.
That was a very emotional call.
I'll tell you what my heart rate would be if
My
someone
heart
tried
would
to
be like 220.
That's my point.
That's crazy stuff right there, dude. You don't need to be tormented like that, you know?
A lot of times, victims of sexual abuse are afraid or embarrassed to come forward. It's never okay to be treated that way, and I'm glad he asked for help.
Glad we were there for him. All right, let's go see if little mama's standing out there. She's probably ready to fight now, dude.
Oh, yeah, she's all...
She's like, I was gonna whoop somebody.
There she is. Good
There
girl.
she is.
Hey, little mama, come here.
What's up, baby?
You see that guy get in a fight down there up 15th?
Yeah.
You said that you saved him.
Could have been a hero, little mama.
She was able to scare off his attackers tonight, so I guess you could say Little Mama was his little angel.
Are you behaving yourself? You doing good?
She just laughs at it.
All right, Mommy, I'll see you later. I can't help but love her. I don't know why.
The Mardi Gras colors going on the dome. It still feels crazy getting around the city this easy.
Like, we beat back-to-back calls.
I remember the first year I worked at ASAP on Mardi Gras weekend.
Now, this was your first year here?
First Mardi Gras working with New Orleans in it.
Hey, they put you on ASAP?
I was on ASAP. It was one after the other. And so, me being new to the city, to this EMS system, to this behemoth of a holiday in New Orleans, I'm like 7 calls behind. I think it was Keely or somebody's like, you trying to type your whole narrative? I was like, yeah. She's like, nah.
Unknown age, under gender, down, breathing. First came out of the seizure, now they're doing CPR. Code 3 in the 5th, you're in OPD in 6249.
So we're going, sounds like a cardiac arrest, came out as a seizure, and now they're doing CPR. Holly's going with us, Holly Jolly.
Holly running her ass off tonight, man.
Some people do have, you know, what's described as seizure-like activity before they go into cardiac arrest. So my gut is telling me this is an overdose.
The fire department's on scene. That means that there's less equipment that I have to bring in, and that means that they've already initiated some form of care.
6249 on scene.
We inside or outside?
Oh, inside.
Yep, I see Holly lugging her stuff in there.
Is it a code, guys?
She's not breathing good, not bad.
Okay. Does it look like an overdose?
Yeah. Just stand by the counter and she just keeled over. Just gave her 10 mils.
Of Narcan?
Yeah.
Perfect. What's her pupils look like? They pinpoint?
Yeah.
Okay.
Giving Narcan intranasally can sometimes be less effective than giving it IV, which means in cases where we don't really see a good response, we want to try to give a lower dose IV to see if we can see a more rapid improvement.
What's going on, huh?
Hey, looks like an OD. They gave her 2 of Narcan IN already.
Is she breathing on her own at all, dude?
A few, yeah, a few little agonal ones.
All right, fellas, let's lift up, get on this stuff. 1, 2, 3.
She still ain't woke up.
Let's continue to bag her, man.
Opiate overdoses can be reversible if we could give Narcan in time. But you know the longer that you don't get that Narcan to block that opiate, you just won't be breathing, which can make you hypoxic.
Hopefully the IV Narcan wakes her up.
I'm sure it would. It's time to wake up, sweetheart.
You getting any response at all out of her?
I can feel it. She's breathing on her own, but it's still like 6 times a minute.
Ooh, look at that.
Yo.
What?
Little polyform.
Oh, okay.
When I find a little baggie with all the assorted pills and the white powdery substance, that complicates things even further because the patient is obviously suffering from an opiate overdose. But there's a strong possibility that there's something else in her system, and so we don't know what's gonna happen when we push this Narcan.
There she go a little bit. Oh, there you go, there you go. Oh, hold up.
It's paramedics, paramedics.
No, come now. Hold on. Calm down.
Get some restraints.
Yep.
Let me see that on.
We're responding to a patient with a suspected opiate overdose, but it seems like it may be something else in her system.
The IV come out over there too.
You all right, baby? Calm down. You all right? Let me tell you what happened. You passed out, but now we got your back. But I need you to calm down. All right. You just told me you was gonna calm down.
It's not even.
Oh, you can't help it? Is that stuff? All right, what did you do, baby?
Just take that tape and wrap it around
Did you snort it or did you
snort it.
You snort? How much did you snort?
A lot.
A lot?
A lot. I believe it.
There you go. I'm gonna try to get another line and we can just give us some Versed.
Don't give me no more of that stuff.
Do we not?
All right, baby, we're gonna give you something to help you calm down, okay?
I can't help it.
I know, love. That's why we're gonna give you something to make you feel a little better. It's gonna calm you down.
Please.
She's just agitated, and so it's either one or two things that's the cause. It's the fact that we just rapidly detoxed her, or it could just be that she's speedballing. So we're gonna give her Versed so that we can kind of get her back to a more normal state.
All right, I gotta get this IV to give you medicine, okay? Can you hold still
Look,
for me?
let me wipe your mouth, love. You all right? You all right?
All right, mama, that's it. Now you just gotta hold still.
Almost done.
Don't move. Don't move. You're good. All right, give me the damn person. All right, 5 is in.
It's gonna stop.
Yeah, it's gonna stop.
That medicine should kick in any second.
Night right now.
All right, her sets. All right.
Shoot.
Let's put on a little O twice.
Oh, yeah.
Look, oh, twice.
Whew. I ain't coming on no more calls with y'all.
Look, you making us work way too hard.
Y'all drama.
Let's go, man.
Whew. All right, y'all be careful.
All right, thank you, Holly. All right, baby. We got you, love. You all right. You done wore us out.
If you don't take at least decent care of yourself, you ain't gonna make it very long. Then you gotta retire. You can't hang out with me no more.
I can't do shoulders when you talk like that.
I mean, God knows we want to live long enough to support our kids and their kids.
Night's begun. You think it's gonna be busy?
Yeah. Call comes in for a 15-year-old male having a seizure.
Possible seizures. Holy crap, look at the people. What in the world?
Rescue 4 on scene.
He's pretty knocked out.
He's been out like this since.
How old is he? How old is he?
A shop owner tells me that we have a kid that was running, slipped, fell backwards, struck his head on the ground, had seizure-like activity, shaking and thrashing about, and has been unconscious.
I don't know if the seizure happened before he fell.
Probably after.
Season after the fact.
The biggest thing now for us to think is this kid has a head trauma.
You want to put a collar on him?
Yep, put a collar on him, put him on the bed. He's good.
Strap his arms in.
Let's load him up.
What's up, brother? Is he awake now?
He's opening his eyes.
That's what we want.
Open your eyes.
No, calm down. Relax.
Relax, Jeremy.
As we get him in the back of the truck, the patient becomes highly combative, typical of someone with a good amount of head trauma.
He's having a moment. Strong like ox.
He is strong.
Hey, listen, Jeremy, listen. I'm Lieutenant Mabel with Tampa Fire, okay? You fell and knocked yourself out, brother. Okay? You need to kind of just relax. We've got you strapped down because we want to make sure you don't have any kind of injury.
I'm just going to look in your eyes.
Give him the better man.
I want to move his arm.
Huh?
Unequal pupils.
All right, then we're called for trauma.
Trauma alert, yeah.
One of his pupils is bigger than the other. Usually signifies there's a great possibility for a brain bleed. It's imperative this kid get to CAT scan as soon as possible.
It's Tampa Fire Rescue 4. I got a 15-year-old male, slip and fall, head injury, possible seizure activity.
The next 48 hours for this patient are going to be very crucial.
A set of virals right now. He's been fighting this the whole time.
If the patient has a brain bleed, he's going to be watched over and over every hour for the next 48 hours to make sure it's not getting any worse.
There you go, bud. Just relax. There you go.
So it takes 4 milligrams to knock an ox down.
Easy.
Hey, listen, don't be scared, okay? We're going to get you checked out, all right?
32 code 204.
Kid fell, slipped in a puddle, fell back, hit his head.
That was a good call, though. For a ground level fall, that was about as extensive as it gets. Yeah.
Combative.
Yeah, when he woke up and he was combative, I was like, he's got to have something going on there. No, he was out. That kid was out. I haven't seen anybody knocked out like that since Tyson.
Rescue 13.
Rescue 13, 57-year-old male. His wife says he has an internal defibrillator for his heart that keeps going off.
Acknowledge, thanks.
That's not the guy.
the same
that's
guy,
the
yeah.
guy with the pacemaker?
Yeah, that went off yesterday.
I recognize it from a call we had had the day before. He refused all treatment and care. So red flags go up because there's obviously something wrong with this patient's heart, and at any point he could die.
Is that him right there?
Yeah. Good eye. Hey, partner.
Ain't nothing wrong.
But it keeps going off, buddy. I'm afraid you're gonna die. Do you know why it's firing? Because your heart's going too slow or it's going too fast. And it's firing multiple times, means something's going on with your heart. Listen, look, I am afraid that we're gonna get a call in about an hour and you're gonna be dead. How many times has your defibrillator gone off? I understand. And I want to make sure that you can get home, but you're gonna die if you don't go to the hospital.
I knew right then that he had just received another shock from his defibrillator.
What's going on, man? But you said that the last time that we saw you on the last block over there. You said you was okay.
I am.
How many times have your defibrillator fired since we seen you last time?
I just want to take me up and lay down.
Come on, man. Why are you walking away?
I'm fine. I am.
Buddy, it's game over. Send me TPD. I'm gonna need a Baker Act.
If we feel that the patient is going to be a harm to themselves or others and are refusing care,
No, we can't leave you alone.
they can be Baker Acted and forced to go to the hospital. And they don't let them leave the hospital for 72 hours.
He's going now.
No, come on, man. I'm fine.
It's game over.
Come on now. So you just gonna run off again? Yeah, you
If
good.
you run,
but
they're gonna
defibrillator
arrest
keeps
you.
firing.
Ryan, come here, baby. Ryan, come here, baby. If you run, you're gonna get arrested, baby. I just want to check you out, sugar.
This patient's getting too worked up, too agitated, and we decide we're not going to chase after him. We don't want to push this guy's heart to the limit to where he gets shocked again.
He jetted out the side and ran away.
Shot him 4 times back to back last week. He wants to go to the hospital, but he's concerned about this little job that he got going on tomorrow. Because my grandbaby birthday, he said he want to give her a lot of gifts.
Now I'm in a dilemma. Do I have this guy Baker Acted for 3 days, not letting him get to his job and get gifts for his granddaughter? I obviously got to err on the side of the patient's health.
You ride the ambulance.
Listen, and if you go voluntarily, they'll check you out. If you're okay, you come home. If you make
Let's
us
go,
listen.
but I'm fine. Let's go.
Okay, let's
Well, he's pulling the rescue car around right now. We'll hook you up to the monitor out here.
Right here. If you
Okay.
see nothing wrong.
Okay.
If you see nothing wrong.
Okay.
Nothing wrong with it.
Okay.
Nothing wrong with it.
At this point, I'm pretty sure that it's going to show some type of abnormality so that I can show him that something is actually wrong with him, and he will let me take him to the hospital.
Everything looks fine, and this is just driving me nuts. And it does, it looks fine.
Okay. I mean, y'all are the medical. If he's medically good, there wasn't a reason I think.
Even though the EKG showed no abnormalities, this patient still could be having a cardiac event. If he's adamant about not going, I don't wish to Baker Act him, but he's definitely going to need to follow up with his cardiologist.
Okay, Ronnie, listen to me, okay? So no, my turn. I'm gonna have you sign another one of those papers. If I come back, look at me. You're going to the hospital with me, okay? And I don't want any arguments. I also need to say, in front of all these people, that I think it's a horrible choice that you're not going to the hospital and that something bad could happen to you. Do you understand that? Okay. You are signing against medical advice. We are stating that you need to go, and you're stating that you're not going to go. Yes, if you don't mind.
I appreciate you doing what you did.
I understand.
But ain't nothing wrong with me.
I understand, but I'm worried about you, and it's my job to be worried about you. I take 10 people to the hospital a day that don't need to go, and you're the one that does. Have a better night.
I would say he is like most men when they're sick. We'll wait until we're about to die before we'll admit that something is truly going on.
If he goes home and he goes to sleep, it's probably not gonna fire again, and he can go get it checked out in the morning. And I don't want to see him Baker Act for 3 days when I respect his intentions of wanting to go to work, you know, to give his granddaughter some gifts. Dude, you are tugging at every heartstring that I have, and I'm a little bit angry at the same time, so I don't know what to do.
You can't even be mad.
I really hope I made the right decision with that guy.
Rescue Force, TBD is reporting man down on I-275 South.
All right, home slice. I-4 westbound to I-275 southbound, traumatic injury. It's right in that bend, isn't it? We're going with wreck. Remember that wreck of the motorcycle?
Which one right there? We get them all the damn time.
Yeah. This portion of the interstate is known as Malfunction Junction. We get a lot of accidents in this general vicinity. We never really know what we're gonna run into. Rescue 4.
Oh my God, I can't move.
You're not supposed to. You're not supposed to. 30 feet from up there, he jumped.
He jumped down?
Yes. Landed side of his face on the ground.
So we're trauma alert?
Yeah, unknown injuries, just completely can't breathe. He's got a lack on this side of the face.
Rescue 4.
1, 2, 3.
All right. Our biggest concern from a 30-foot fall is we want to make sure that he doesn't have a brain bleed, and we want to make sure he's not bleeding to death internally.
That hurt?
Yeah, it hurts. Stop. They're starting IVs on you.
What's hurting?
I can't breathe.
So your chest is hurting or you just can't breathe? Moving there. Left side is diminished.
Doug listens to lung sounds. We can't hear anything on the left side.
I can't breathe.
We're worried that his lung is now collapsed.
I'm dying. In the cab now. We're out. Let's go.
A collapsed lung is a very dangerous situation.
You hurting really bad?
It doesn't allow you to breathe readily and adds so much pressure in your chest that it doesn't allow your heart to beat.
Assess those lung sounds one more time, please.
You got fluids right here.
Is he tight?
Tap it. The patient can't get enough oxygen. We have no choice but to do a needle decompression to his chest. And we want to allow his lungs to reinflate and give him a chance to get a good breath of air before his body starts to shut down.
How you doing, big guy? Huh? You're in the air. Assess those lung sounds.
164 over 81. Look, I think we did get a pressure relief because the stats went up.
Now we have lung sounds. We look at the monitor. His vital signs are much improved.
Sir, you still with us?
Yeah, he's with you.
Rescue 4. Arrival hospital.
You're doing great. You're getting better.
Rescue 11, we have a call of man unconscious on balcony. Possible overdose.
What's the comments? What do we get with those?
Ineffective breathing, unconscious.
We get a call, overdose, CPR is being attempted by Tampa Police Department officers.
Rescue 11 on scene. Grab a board.
Come on. Zool? Yeah, that's it.
They gonna load him up.
All right.
Snore respirations.
All right, you have the pads out.
Let's just get him loaded.
Pull the board down, guys. We're gonna roll him. Is it 2 man or 1 man? 1 man roll's fine. Yeah, let's just roll. Go ahead and strap him.
My brothers from TPD did a great job of keeping this guy going until we arrived. But he's fading fast. He needs Narcan like now.
All right, what's wrong? Hey, we don't got time for that. Let's go. We gotta go.
We got called to a drug overdose, and then he's guppy breathing, which is not good.
Just gonna carry it down.
1, 2, and 3. Clear. That's where going down your way. All right, slow it down, slow it down. Every roll is in the side of the bag of that. Be quick about it, Andy. We're gonna get going. Let's go.
Everybody relax. Do what we do.
Sugar is 155.
Let's get him on the pads.
Yeah. 16, right AC.
Let me see something. Sir. Unresponsive. What's your name? All right, keep bagging him.
You got an OPA in?
I'm giving this patient a shot of Narcan. It's an opiate blocker. When it works, it literally will bring a patient back to life.
Wait a minute. Hey, he's coming up. Hello. We'll take you to the hospital.
You were unconscious.
You know what I did? I hit him with some Narcan. I am
ninja mode, brother. Of course.
I ain't new to this. I'm true to this. What kind of drugs you took? My name's Tony, man. I don't know what you did tonight, but you was this far, man. You was this far from the light. I'm not preaching to you. I'm just saying a little bit more. If somebody wouldn't have found you, man, we'll be taking a trip somewhere else. To the morgue. This is a wake-up call for you, buddy.
With ODs, whenever I can, I try to give the patient some real talk.
Spike a bag for me. Try to get that heart rate down some.
He's breathing on his own. Let's put the BP on. What'd you take tonight? Opiate? Say you didn't take an opiate.
That's
hey, he's vomiting. So you gotta start something. You want to spit more out? Spit it out.
We saved this guy's life this time, but next time may be too late.
Well, he he said bless you and bless your families. He said he's gonna change his life.
That's cool. I mean, he definitely looked shell-shocked, like, oh, I messed up.
Probably was a wake-up call for him. So that'll be one less call we'll have to run to in the future. Hey, that was good work.
Thanks, brother.
Good work.
City of New Orleans, 911, what's the emergency?
My uncle need an ambulance. He cannot breathe.
Is he responding appropriately?
Every time he responds, he gotta take breaks.
Did he have any flu-like symptoms prior to this?
No.
Okay, I'm sending the paramedics to help you now.
Alpha 3251, can I have a 6060-year-old male short of breath?
We're going to a 60-year-old male who's short of breath, difficulty speaking between breaths. He does not have an inhaler, no evidence of coronavirus, which means he probably has coronavirus.
We're just kind of throwing out different ideas of what it could be. We're thinking it could be CHF, it could be COVID. So we're just kind of trying to prepare ourselves for what we may find on scene.
How you doing, my friend? Been short of breath for how long?
Actually, since 2005.
Since 2005. Has the oxygen help that they put you on? No, but this right here is oxygen. Has this helped your breathing?
Is this thing here helping you right now? Okay.
Okay. All right, my friend. So we're gonna get you outside, get you on the stretcher, take you to our truck, do a few more things in there, okay?
This patient has a pacemaker. Automatically, anyone with a pacemaker, we're always wondering if their shortness of breath is caused by any sort of cardiac issue. So COVID is still on the table, but it's a lower differential diagnosis.
He was breathing awfully hard, isn't he?
Mm-hmm.
So listen, we're gonna try to get another blood pressure on you. I want to try to give you some nitroglycerin. I think that may help you breathe better.
This stuff's working.
It is working. Hey, your pacemaker's working. That's always a good thing.
They told me to give it was off for a couple of days.
I'm glad it ain't off right now.
Mm-hmm. All right, my
You
friend.
said no chest pain, right?
Yeah, like, it's not like a real thing.
You're like,
irritating.
Irritating how? We got time, start explaining.
is it like a pressure, like a tickling?
Yeah, like a little pressure.
Like a pressure? All right. So I'm gonna spray some nitro under your tongue, all right? So do me a favor, open your mouth real wide, lift your tongue all the way up. There we go.
Oftentimes, a breathing problem is actually a heart problem. And given this patient's history, that's what I think is going on.
Now, I want you to tell us if that makes you feel better.
Nitroglycerin allows the heart to work more efficiently.
All right, buddy, you can feel a stick in your hand, okay? Relax this arm, we'll just let it fall down. Let it fall, there you go. You gotta relax.
You doing all right? You can't breathe?
All right. Check and see if he's in VTAC. Okay. I know. Listen to me, okay? Your pacer stopped, so we're gonna pace you, okay? Just relax. You gotta relax.
We're responding to a male complaining of shortness of breath, and all of a sudden, his pacemaker has stopped working. So right now, he's at risk for his heart stopping completely.
You're gonna lean you forward.
We externally put the defibrillation pads on him because our monitor has a pacemaker setting.
How you feel? Talk to me.
Much better.
Might be better?
Much better.
Hey, man, don't you let that damn pacemaker stop again.
Luckily, his pacemaker then starts to work again, and we don't actually need to deliver any sort of external electricity from our monitor.
How do you feel right now? Better than when we first got here? That spray of nitro helped, didn't it?
Yeah.
You know, that's one of those cases where we do everything right and then something bad happened in spite of everything we did. Did you see a light? Okay.
All right.
All right.
Good. Don't let it.
This man's pacemaker has stopped working. It's malfunctioning. It's not firing all the time when it's supposed to. It will intermittently stop, which is causing him shortness of breath. And once that pacemaker is replaced, all of his symptoms should dissipate.
We thought we lost you. Has that ever happened before?
Not like that.
Not like that? Damn certain you need to see a doctor.
City of New Orleans 911.
I think I just had a miscarriage.
Do you see anything like fetus or tissue?
I just see a lot of blood. I was using the bathroom.
Okay, so do you see like tissue or anything, or just blood?
I don't know.
Okay, ma'am. I'm sending this call to the dispatcher now. Don't flush the toilet, okay?
Okay.
Also, a 20-year-old female in her first trimester, fighting, close to in the fifth.
You're past your first trimester,
way
but
past the first trimester.
you are with child.
Yes.
Well, I wonder how far along she is in her first trimester.
I mean, it could also not be an issue because some spotting is normal. Depends on how much and what color, and is there any pain associated with it?
Being pregnant myself, my heart goes out to her. This could be normal spotting, or it could be something more serious.
Right there?
I'm guessing so.
That's it, right there.
Let me just see what's going on. Hey, baby, we here for you? We here for you? Okay. What's going on, love?
I don't know if I had a miscarriage. Just I was bleeding earlier, but it wasn't a lot of bleeding.
Okay, is it somewhere?
She told me don't flush the toilet.
Okay,
but I was
it's in the
using
toilet.
bathroom.
Uh-huh.
As awkward as it is, part of our job now is to see what is in the toilet. Is there tissue? Is there blood? Does it look like she had a miscarriage?
How far along were you, baby?
That looks like tissue.
So I think that's a miscarriage. So when we look down in the toilet, we see expelled tissue that is bright red in color. In the first trimester, mostly you're gonna see nothing but tissue. I'm pretty confident that this patient has miscarried.
Where was your OB doctor? What hospital?
Have you seen anybody yet?
I had an appointment tomorrow.
Hey, well, look, I think you most probably need to go and
Just let him
get
check
checked.
you. Okay.
Okay, they need to make sure one way or another.
And you want to grab your stuff?
I can't imagine emotionally what's going through her mind.
You got family you want to call or anything?
How is Beth?
No? Okay.
Knowing that there was this life inside of her that's not there anymore. It's heartbreaking.
You okay?
I just don't want her to see my belly.
You want me to take this?
I don't want it to hurt her that I'm pregnant and she just lost hers.
I'll take it.
Let's walk to the truck, baby. And I got your key. I'll lock your door for you.
She is just so brave. She is attempting to hold it together, but I can tell that deep down, she's hurt, she's upset. And it's times like this when our job becomes not just about the medical side of things, but we also now have to treat the emotional side of things and just try to be there for her.
Take a quick set of vitals on you. Go ahead and lay back. There you go. Let me see this finger. One finger over here, my babe. It's okay. All right, babies. Was this your first pregnancy? Okay.
I hope that this patient remembers that this is not her fault. This is nothing that she did. She didn't cause this. And I hope she knows that this doesn't mean that she's not meant to be a mommy, and that one day she will be.
We can't definitely say that you had a miscarriage. They're gonna have to do an ultrasound and they'll check, see if there's a heartbeat there, you know, and then they'll take it from there, whatever they see, all right?
Hey, girl. Those calls always kill me.
Yeah.
I always said,
I can't say I know how she feels because I've never been pregnant and I've never lost a child, you know, an unborn child, so.
Yeah.
But I'm sure, you know, it does a number to your head, so.
I can't imagine
I'm
being
sure
in her.
you can't.
I mean, I know those first couple months were definitely the scariest, the most stressful. Don't want to say anything to anybody just in case something happens, so.
Right. She'll survive this. You know, it's her first pregnancy. I know it's tough.
Hope she finds somebody to at least be able to talk to, and
she'll be okay.
You deal with so much loss and so much sadness that you have to depend on your partner to be there, emotionally and physically for you. And I know that Lori has my back, and if I need a few minutes to cry, Lori will be there, and we'll be on to the next one.
All right, girl. Guess we go out there and get another one.
Let's do it.
All right, girlie.
You Bulldog fan?
Yo.
Yeah, you're what do you call it, Georgia State, right?
I went to Clark Atlanta University,
Right.
home of the Fighting Panthers.
Oh, you know I was a Panther too?
What?
Kingswood Elementary, bro.
No,
Kingswood Panthers, baby, get some. You working on that, Joe.
That sounds like a broke toilet trying to flush.
Rescue 11, we have a 30-year-old female with chest pain and trouble breathing.
Rescue 11 responding. Whoa, what's going on?
I had a chest pain, bad chest tightness, associated with pericarditis. I have inflammation around my heart. With any stress that's not looking together, it gets inflamed.
Have you been coughing a lot?
Yeah.
What happened tonight that exacerbated it?
My husband almost put it on me.
Patient says she has pericarditis, which is swelling around the heart, and that itself can contribute to the heart not functioning as it should. Now, your heart rate is up. We're gonna always recommend for you to go to the hospital.
Then I'll go to the hospital because I feel like I need to.
Okay. It's a serious condition. That with the combined stress and what's going on scene, this is a potentially dangerous situation.
Rescue 11, transporting to Florida Hospital.
How long have you been married?
We were together for almost 12 years. But now he has another woman and a kid, and he's
Wow. Did he tell you about that, or you found out? Wow.
You know, we're supposed to door down, trying to get in. The kids are in front, and I closed the door, and she wouldn't come in.
I'm so sorry all of this has happened. But sometimes God makes things uncomfortable for us because we're not supposed to be in a situation. I wish you all the luck in the world. This is a song of mine. When you have troubles, just remember, oh God, so hush and don't cry. Hugs. I want to do whatever I can do for my patients to make them feel better. You're gonna be fine. I'm Tony.
Tony, God bless you.
God bless you as well. If that means talk to them, I'll talk to them. If that means laugh with them, I'll laugh with them. If that means make them laugh, whatever it takes to make my patients feel better, I'll do that.
Well, we gave it some love, brother.
We did. We cheered her up for the time being.
That's all we could give it.
Yep.
We didn't have no medicine for her.
She was a nice lady.
Sometimes that's all people need. She's got to get out of that situation, though, man.
We're headed to a female that's stumbling on the street, possibly fell and hit her head, but they're saying that now she's just like sitting on the curb. And a good Samaritan thought to call it in.
Do you think we're gonna be like busy Mardi Gras, even though they're not having like all the parades and stuff?
100%.
Like, this is New Orleans, like it's Mardi Gras. You can cancel the balls, you can cancel the parades, but you cannot cancel Mardi Gras. 3250, we're in there. Hi.
I caught her walking in the middle of the street stumbling.
Okay.
I know she has some head injuries, but it seems like she's 19.
Okay. Hey, baby. Hi, sweetheart. Oh. Oh, I know this girl. She likes to fight.
Mm-hmm.
Oh, yeah.
She swung at you?
I've been swung on by her at least like 5 times in my career.
I know exactly who this patient is, and she is a feisty one. So if I approach her in an aggressive way, this whole situation's gonna go downhill. So it's just gonna take a little finesse, you know?
Hey, sweetheart. Hey, look. You were stumbling around, okay? So we're gonna take you on over to the hospital, all right?
Drop 3243 is item.
You can't see?
Show me around.
Intoxication can mask signs and symptoms of brain injuries and neurological deficits from head injuries. So we need to get her in the truck to be evaluated.
All right, baby.
Hey,
you
my love.
ready?
3249.
There we go.
3243.
Perfect.
3249.
We got a couple seatbelts for you, okay? No, we got a seatbelt in, okay? We gotta stay seatbelted, okay? No, we gotta stay seatbelted in.
Where's the
man?
Stay in.
Stay seatbelted in.
Where's she at?
He's right there.
Should be.
Yeah.
You're gonna be all right now. You're welcome now.
You gotta stop undoing them seatbelts.
No, you're not doing anything wrong, but you gotta stay with the seatbelt strap. Mm-hmm.
Seatbelts stay on. Seatbelts stay on. Don't take them off again.
You hit the wrong bitch.
We just trying to help you. No, we're not talking about that.
Y'all ready? Man, beat the out you.
No. Stop.
You think you strong?
Stop.
Man, why you have to go and do that?
Just go ahead and, yeah.
Lindsay and I are responding to an intoxicated female with a possible head injury. But because our patient is trying to unbuckle her seatbelt, we have to restrain her to the stretcher to make sure that she doesn't try to jump out of the back of the ambulance.
All right.
That's better. Almost. There we go. That's better.
All right, now let's get your blood sugar.
Y'all do what y'all want to do.
All of her vital signs are good. I don't see any signs of head trauma. So most likely, her only complaint is gonna be intoxication tonight. In New Orleans, people who are showing clinical signs of intoxication, we have to transport those people to the hospital just to get a little checkup, sober up a little bit, and then be on their way.
I'm gonna kick you.
We're not gonna be kicking anybody. That's not nice. That's not nice. Yeah, I'm just trying to bring you somewhere so you can get some nice rest, sober up, get some food.
I noticed that my girl is wearing a Mardi Gras t-shirt, and it's just another reminder that Mardi Gras really is just like so different this year.
What are you cursing at me for? Are you sad that Mardi Gras isn't having all the praise this year? I think we're all sad. Yeah, as soon as you sober up.
Do camels really spit?
Yes. Camels are the nasty, one of the nasty, ill-tempered.
Just hateful?
Camel's like a moose in the desert.
Moose are mean?
Moose will kill you, boy. Moose will go out of its way to get on you. And the thing about camels is that they're not just nasty. I think they plot. You know what I mean? Anytime an animal plots,
it's not good.
I got a problem with that animal.
Maybe they need like psych meds.
Rescue 4, you'll be responding to a 55-year-old female with asthma and chest pain.
Chest pain, 55-year-old female, not alert. Is that it?
Chest pain.
Chest pain. Hey, sweetheart, what's going on?
I got asthma, bronchial asthma, and what I did, they had took the toilet up, and that was my fault. I went in there and put bleach,
Okay.
and I took the toilet bowl clean and pine, and it's like,
Bam. Gotcha.
it got
Just kind of took your breath away and stuff? All right. Let me give you a little albuterol, kind of help open you up, all right? You got an ID near you, baby?
You doing, wheezing?
She's oozing all over.
It's all right. Do that later. Get in the truck.
What we got, Billy?
cooked herself with some ammonia and bleach. She's got asthma.
Oh, an asthma attack?
Yeah, it's ammonia and bleach.
Ammonia and bleach is a very toxic chemical mixture. It puts the patient into wheezing and difficulty in breathing that has to be treated.
Come underneath my arm. Just because you holding on to me so much don't mean we dating now.
What my son I need for him to get mine?
What you need from him?
My purse.
Okay.
Hold on, help me.
At least you didn't call me Jesus. We move the patient out to the truck and start her on a breathing treatment.
Put this in your mouth real quick.
So your only history is asthma, or you have any other medical history?
I have lupus.
Okay.
High blood.
Open your arm.
Breathe in,
1, 2,
breathe in,
3.
relax. Let it out slowly, okay?
That's going to help you breathe it, okay?
It's on the counter.
On the counter?
Look on the counter or either on my bed.
Hey, you don't hear me talking?
Go, I'm trying to tell you, go get my phone and my keys before they go.
Can you get the phone and the keys out of her room, please?
Okay, that's what I'm trying to tell you.
It's on my...
I'm trying to help her. That's why I got put it on her face.
The patient's son is very emotional.
We gotta go.
I need my phone and my keys.
Don't you ain't gotta put your hands on me though.
We're leaving. I don't.
My hands are right.
My hands are right here.
So what you gonna do?
I exited the rescue car, went to the back to try to create space so that we can treat his mother, and he didn't really appreciate that very much.
That's my mama in there. I don't give a what the hell one of y'all.
I want her phone and her ID out of her room.
That's my mama in there.
Before we leave. And her key.
Which room is it? I'll just go get it.
We know, we're treating her.
We're trying to help her out, brother.
Hey, man, you want to show me where stuff is so we can go get it, Phil?
A lot of times people get very emotional. They can be a help or they can be a hinder.
I get it.
My mama.
I get it, man.
You have to be tolerant, you have to be respectful, but at the same time, you cannot compromise the patient's care because someone is having a hard time dealing with the situation.
You got your phone and your keys, and you're good to go, okay?
Thank you. Appreciate you looking. You're okay, nice and easy. With all that fumes that you took in, and mixing all that stuff, tends to kind of eat you up a little bit. It's all right, nice and easy. You still got a little wheezing going on in there. Go ahead. So we give you albuterol, open you back up again. Relax a little bit. Take this off. The albuterol is helping pretty good. On the way in to the hospital, I'm doing everything I can to make them at least smile, knowing that it's gonna make them feel a little better. Your wheezing's easing up, so I know your lungs are opening now, okay? You're gonna feel 100% better, and you're fixed. So you can quit calling me God now. Don't make you laugh, huh?
Yeah, I gave it a little chemical warfare lesson on the no ammonia and the bleach together. A lot will kill you, like that. Like, I'm dead.
She didn't pour it in the toilet.
Where'd she pour it, on the floor?
The maintenance man pulled the toilet off.
So it's just a hole.
There's a hole right
And
now.
she's
So she poured it directly in the sewer.
That's a losing battle.
She's like, burp, burp.
She needs a new maintenance dude.
Yes. Fired.
Yeah,
Fired.
done.
City New Orleans 911, what's your emergency?
My wife is going into labor.
Okay. Can you see any part of the baby now?
No, I cannot see none of any part of the baby because she's sitting on the toilet. Hold on, wait.
Just tell her to breathe, Clarence. Just tell her to breathe through her contractions.
Breathe.
Contractions off. 1 minute apart. Less than 20 seconds. Hey! Feel like she's coming out.
Lord have mercy. Oh, breathe, baby. Breathe. Get somebody AIDS out.
All right, I've sent the information over to the dispatchers now. Stay on the line. I'll tell you exactly what to do next.
Alpha 3244 for a 29-year-old female per her husband. She is in labor. She cannot see or feel any part of the baby yet. The code 3 and the 3rd was fired.
So I believe she is 30 years old, in labor. Some people like having that baby at home. Now, whether or not this was a planned, I'm gonna wait until I have this baby, almost ready to have this baby, so possibly have it at home. You know, so we may be delivering a baby or the baby may be delivered by the time we get there. Over the last 27 years, I've delivered about 13 babies. It's one of the most exciting things that we do in EMS is to bring a life into this world. It would be safer for mom to have this baby in a hospital, but if it has to be delivered in the field, I want to be the one that's there to do it. 6249 on scene.
Alpha 3230 blue.
Yeah, grab your
Vehicle
OB
and
kit and a stretcher.
40.
Hey, babe, you daddy?
Yes, I am.
Congratulations. This her first baby?
Third, ladder 7.
Fourth?
That female.
It's okay, baby. It's okay. She's crowning at this point, so we know we're not leaving until this baby is born. It's okay. Take a big breath. There it is. Baby crying. Baby is out. The baby looks good, has good color. She immediately cries. That's what we want to hear, a cry from that baby. Now we're gonna let Dad cut the cord.
She got some healthy lungs.
Gotta cut the cord, baby. Dad, you wanna cut the cord? Let him cut it. Come on. Watch the feet, okay? Come on, boo.
Okay.
You want me to hold this? Come on.
Watch your fingers, okay? There you go. Perfect.
That's it, it's done. All right. Give me that. That's okay. Don't panic, Daddy. All right, Mama, listen. Listen, you're still gonna contract, okay? Because you gotta deliver the placenta, okay?
So, wait, what you want me to do?
I don't want you to put it. It's gonna deliver by itself, okay?
Pull it out?
No. No, that will make you hemorrhage, okay? All right, you'll deliver on your own, okay?
He came very quick.
I see that. What baby is this, number 4?
Yes.
Yeah, congratulations.
This is baby number 5 from
Baby number 5. Hey, boo, you excited? Huh? Look at that, she loves her daddy now. Just a feeling like no other when you bring a life into this world. I feel very privileged in order to share this moment with this family. I'm feeling on top of the world at this point. You want to see the baby? Look.
A baby seeing another baby.
Look
Oh,
the
wow.
baby.
A 3-year-old
Yeah?
seeing
Oh,
a
what you
little
think
baby.
about that, huh?
Ma, that used to be you. That used to be you. I'm sure.
Even though this was a very successful delivery, we still need to get mom and baby to the hospital just to make sure that everything's going to be good.
Here, I'm gonna go bring her out to the truck, okay?
You got her?
Yeah, I'm gonna go do some blow by.
Okay, go ahead and do blow by. Baby's hands and feet are a little blue, but that's very normal. So we're gonna try to pink them up a little bit by giving some blow-by oxygen. How's that, babe? Pinking up?
A little bit.
We don't put it directly on them. We just kind of hold it in front of them just so that they can get that enriched air that they need. All right, they're coming out with mama right now. Look at that boo-boobies, look.
She hungry. Waiting on mama. So excited I'm so excited.
You still trying to deliver that thing, girl?
Yes.
Girl.
Oh, look, hold on.
No, you need that. I don't want to hear nothing from you.
do needles.
I don't. Well, look, you laying down, so you good.
so much. Ow. Why is
Really?
a big needle?
No.
Big needle? That's a baby needle.
Hold on. Hold on.
Ow.
That's it. It's over with. You done delivered a baby, and you're gonna yell about that little needle.
Yeah.
That big old thing just came out where?
Yep.
Uh-huh.
She said I still don't do needles. I don't do needles.
All right, Mama, you're gonna have to hold this baby on the way. You ready? Unfortunately, we see too many people leave this world instead of coming into it. But when we do bring one into the world, it's a great feeling. Remember, now look, I know you ain't set on the name yet. Look, Key Lori might be good. My name's Lori, okay? So Key Lori.
Lily's a pretty name too.
Oh, Key Lily? What is that?
It's exotic.
It's got to have key in it.
Exactly. It's
So,
exotic. That's why.
all right, let's go, Lily.
All right. You ready, Matt?
All right.
Thank you, ma'am.
6249. Ma'am, you can go ahead and put the unit en route to Turo. I'm gonna go ahead and follow them there just in case.
City of New Orleans, 911.
Hi, can I have an ambulance?
Tell me exactly what happened.
My cousin is having a seizure. He has seizures all the time. He's on medication right now.
Okay, is he awake?
No, ma'am, he still seizing nothing. Another one about to come on. Lay back. I'm right here. Lay back. Give me a towel. I'm right here. He's still seizing.
Okay, ma'am, I have EMS and the fire department coming out to help you.
0505-year-old male unconscious after having a seizure.
2. Something that raises some concerns. It could be a febrile seizure. It could be he could have a history of seizures. Because 5 is a little old to be having febrile seizures.
Yeah.
It can still happen, but.
Is it me or are the seizure calls? I feel like have been increasing lately. I feel like we've been on a lot.
feel like we go to seizures all the time.
I know.
But like steadily all the time.
Yesterday we had like 3 of them.
Mm-hmm.
Yeah. Usually by the time we show up, they stop seizing.
Yeah.
Seizuring.
Seizuring. Is it seizuring or is it seizing? Pretty sure it's seizuring.
I'm gonna have to give that a Google.
A goog.
Give it a goog.
Give it a goog. Let's see. Hi. Oh, he's not 5. It's not a 5-year-old, it's a 33-0.
I'm good.
Hey, baby.
I'm just tired. I'm good.
You're just tired.
Huh?
She said that you had a seizure.
I'm good.
Well, let us just check you out, okay?
Huh?
Let us just check you out.
This is what he's taking at the moment. Now, this is how he is when he comes out of the seizure.
Really? Do you remember having the seizure at all?
Huh?
Do you remember having the seizure at all? Can you tell me where you are right now? Can you tell me where you are right now?
No.
Good. Can you tell me what city we're in?
New Orleans.
Can you tell me what year it is?
2021.
There you go. Let us get y'all checked out, my man. You're still super sweaty. You're still breathing pretty hard, okay?
Our patient's awake. He's talking to us, but you can tell he's super sweaty. He's a little confused, but he's awake and talking to us, which is a good sign. Means that most likely he's not actively seizing at this point.
They usually come in 2s.
2s? How long between, like, before he goes into another one?
Basically, if he stands up and goes to the ambulance with you guys, he's gonna have another one in the ambulance.
All right. Why don't we just go ahead and get you to the hospital, all right?
I'm straight.
Well, she said that you normally have 2 in a row.
2 in a row what?
Seizures.
I'm good.
So if you've already had 1 seizure,
I'm good. I promise you, I'm good. Just,
you still sweating bullets, my mans.
I'm good.
But if you have another seizure,
I'm good.
all right?
His significant other tells me that he usually has more than 1 seizure in a row. She doesn't know when the other seizure's coming, but she knows it's coming. So it's incredibly important to get this guy in a controlled setting to where he's not seizing in this house, and then we're trying to have to fight him, give him drugs to sedate him, and then try to get him out of this house to the stretcher.
I gotta lay back down. I'm good. I just wanna lay down.
I know you want to lay down, but we gotta go to the hospital.
I'm good. Trust me.
Just don't rip any of the stuff off, but definitely gotta go to the hospital. Huh?
I said I got a headache.
Well, I'm sure you have a headache. Come on, let us take you to the hospital, my man.
I'm coming with you. I'm dressed, I'm ready. I'm coming right with you. You're not gonna be by yourself at all. And that's the only way I'm gonna be able to sleep tonight.
All right.
All right.
Well, I want to get you to the bed outside, okay? We got to get down those steps.
All right, let's get you up out of bed.
Oh, man.
You ready? Come on.
We'll take a couple steps, okay?
You can step?
Yeah.
All right, come on.
I'll see you in a little bit.
All right, come on. Oh, what is that? That don't look good at all. That looks like straight blood. That don't look good.
Let's try to sit in this bed, okay?
Let's get you to lay back, all right?
Right now, this call just got a lot more serious. I'm like, where is this blood coming from? Why is he throwing up blood? Did he bite his tongue and he just swallowed a ton of blood? Or does he have some kind of uncontrolled bleeding inside of his stomach? If he has another seizure, is he gonna start projectile vomiting blood and then choke on it?
Are you allergic to anything?
We gotta get this guy to the hospital.
I'm ready to go. Okay. I'm gonna give you some medicine that's gonna help that nausea, okay? Have you ever had any, like, GI problems? No. I had to put you on a little bit of oxygen because your oxygen was a little low, right? I think you made the right decision about letting us bring you to the hospital. I think you're a lot sicker than just having a seizure.
Alpha 3250, NOPD 230B is on scene, requesting EMS for a female that smoked marijuana, now she's nauseous.
3250, copy. Apparently this chick smoked some weed, and now she's nauseous.
Dude, you know what's crazy? I thought weed helps with nausea.
That's what I thought. I thought you got hungry, happy, sleepy. I thought that was the side effects of weed. I feel like there's gonna be a little more to this.
You're right.
That she hit that pressure and it's got her head spinning.
Yeah.
And now she's nauseous.
That could be.
Due to the spinning of the head.
That is true. That can happen.
3250, we're in the area.
All right.
What's up, brother?
What's going on with her?
Just that she smoked weed and she's been feeling like she wants to throw up for the last several hours. She wants to go to the hospital. She's taking medication for ADHD.
Oh, all right.
This really could be anything. She could have taken something other than marijuana, and there could be a serious medical emergency underlying. And so it's really important that we assess the situation and see what's going on with this young lady.
What's going on with you?
Had some weed, but a really bad high. I felt like I was gonna vomit.
All right.
Panic attack on
Right.
top of it.
Do you want to go to the hospital?
Yes.
Okay. All right. So
All right.
you ready?
Yes.
Let's go, sweetheart.
Oh, no, chartreuse.
Chartreuse?
Chartreuse.
Oh,
Chartreuse.
chartreuse.
Like
The color, that makes sense.
All right. Yeah, we got the stretcher right by the door.
Am I
Let me see.
like strapped to it?
Well, we gotta put seatbelts
Put a
on.
seatbelt
I mean, the
on.
police here, you don't wanna get a seatbelt
okay,
ticket, you know?
seatbelt.
Right. Now stand up.
You all right?
You all right? Did you vomit yet, or you just felt like you vomited?
Thank God, no.
When I see someone that's having an anxiety attack, it's all about talking to them and calming them down. All she needs right now is a little love and understanding, and make sure she knows there's no judgment.
And so I gotta ask, you just smoked weed, that was it? Nothing else?
Just weed,
okay.
weed. I mean, I had mac and cheese beforehand.
Yeah.
Did you smoke it?
As long as you ain't smoked the mac and cheese.
The sauce was homemade.
Oh, really?
That's impressive. You make it?
No, my sister did. She's wonderful.
That's your sister that was in there with you?
No, that was my partner.
Oh, okay.
So the only thing I'm gonna do right now is I'm gonna put a blood pressure cuff on you. But I think you're gonna be fine. You know what? I think you kind of cleared yourself up with your anxiety attack.
Yeah, because now I know there are people here to help me.
We got you. I am gonna put a mask on you just because of COVID, all right?
Okay. I have some nice masks, but I don't think they do their job right? So this is welcome.
This
They're
one's
welcome.
But let me get this blood pressure, then we're gonna get to going, all right?
Yay.
So we're tight. How much weed did we smoke?
It was just one blunt, but I want
Really?
to say 8 puffs.
So has this ever happened to you before?
No, this is a new reaction.
Is this your first time smoking weed?
Well, the first time that it's ever actually done anything to me other than make me hungry.
Y'all be good.
Well, they can take an Uber up there to it. That's kind of loud, I'm sorry. I should have warned you about that.
People who are on drugs of any kind, sometimes loud noises can really throw you for a loop and give you some extreme anxiety.
Look, well, I can ease your mind and tell you everything looks good back here on this monitor.
Well,
You got perfect textbook, perfect blood pressure.
Huh. Textbooks usually have it out for me.
Oh.
Not for like school reasons, but because I'm of a few minority groups. So most of what I was taught back when I was in school was about racism. But they sort of forgot to mention homophobia, transphobia, ableism, a lot of other things, just a lot of bigotry.
Well, check me out. This is a textbook-free zone right here. We're writing our own textbooks these days.
I think her marijuana may have been a little too strong for her, but she's gonna get to the hospital. They'll give her some medicines for her anxiety, but ultimately, I think this patient's gonna be fine.
To me, you're a nice, high person. I like nice, high people.
Because I try to be a nice person.
You are.
It's like being mean takes too much energy. It doesn't feel natural for me. It's just not my thing. Plus,
You got chartreuse with you. They're gonna check you out, and you'll be back home in no time.
All right, little mama, how you feeling? I'm telling you, if all our patients are half as nice as you, we're gonna be all right. But the night's still young.
Caller, are you there?
Sir, I'm on Bourbon Street, and this man is stabbing another man, but everybody's watching.
Okay, where are the suspects now?
He's leaving now.
Okay, listen to me. Somebody needs to get a clean, dry cloth. It can be a t-shirt, it can be a hoodie, or put something on where he is stabbed at and to apply pressure, okay? We're getting help on the way out there.
Please, this man's life is in danger.
I'm headed out with Joe and Titus.
for a male that was stabbed. I don't know if I missed the French Quarter shenanigans or if I'm already over New Orleans, going back to typical New Orleans.
Did we have a code 4 on Bourbon yet?
PD is on scene and they have an apprehension. Let me see if the scene is code 4.
10-4. Thing about stabbings, man, they either bad or they ain't.
At least they're close to the trauma center. Stabbings are just like gunshots. It's like a hole in your body. Your body's not meant to be poked. It can hit an artery, it can hit a vein, you will bleed out and die. We take all stabbings very seriously.
Man, this is like Mardi Gras. This is wild.
Boy, there are some people out here. All right, let's see what's going on.
This little dude right here? This the guy right here. All right. Hey, man. Can I see your back? You know what you got stabbed with?
A handle of an umbrella.
A handle of an umbrella?
Yeah.
All right, you want to go to the hospital, yeah?
I just want to get checked out. Coming through, coming through.
He says it was the handle of an umbrella right here.
Oh.
Damn.
Yeah, something happened to him.
Yeah, that's a puncture one.
Yeah.
He's an activation. Let's get him on a stretcher and let's get him going.
Even though it may not look that bad, tip of an umbrella can be pretty long. So he could be bleeding into his chest cavity, or he could have a punctured lung. So it's imperative that we get him off this scene as quick as we can and get him to the trauma center. This his dog?
That is his dog. I don't know what we're gonna do with the dog. The dog barked at me as soon as I walked up. Is your dog chill or is your dog aggressive?
She's not aggressive.
Honestly.
She will get freaked out if she gets separated from me. That's why I don't know if I should go in or not.
I mean, look, if she's chill, then we'll take her with you. We won't leave her here. We'll take her to the hospital. But if she is aggressive, I'm telling you, I don't know what they're gonna do with her. She's chill? All right, we'll take her with you.
We don't typically like to take animals unless they're service animals because these dogs are usually very protective of their owners. And here we are, touching all over him, providing care to him, and this dog could snap at any one of us at any minute. But in a crowd of people like this, we really don't have much of a choice.
Let's get you up on a stretcher, my man. And we're gonna put her in your lap, all right? Okay, hold on. I know. Have a seat right here. Come here.
Have a seat.
Come here. Hey, come here.
All the way back.
Come here.
No, look.
Can you call her up there?
Yeah, Rosie, up. Come on. Yeah, hop up. Come on.
Yeah, hop
there
up.
There you go.
Well, I've never been as close to a dog before in my life.
You cool with riding this one or you want me to do it?
Man, you got it, because I ain't gonna be about them dogs. Hey, look, hold, make sure the dog don't fall off, all right? Years ago, I went on a bad call and got bit by a dog. So ever since that, boy, I'm straight. I'm too pretty to get bit, man.
You gonna start me a line, Holly?
I got you, fam.
I don't want to have a needle stuck in me.
So they're gonna have to because you have a puncture wound and it's gonna be quick though. I'm better than the nurses, I promise.
I would let her do it if I was you, man.
Do it.
1, 2, 3, boom, that's it. Done. See? So fast.
Hey, look. I need you to breathe. I want to check out your lung sounds, all right? Deep breaths.
Lung sounds are clear, T?
Yeah, they're clear. He's clear.
All right.
Disregard.
All right, guys.
Thank you,
Be
Holly.
careful.
I'm putting a mask on you. I know.
6249, show to the trauma center. 1 patient, you show me clear.
Lung sounds are clear. You got an IV. We're getting that pressure. Try to hold this arm still, all right?
I hate being still. I just hate the hospital. I have to do it.
Well, man, you know, sometimes you kind of got to go, especially when you get stabbed in the back with an umbrella. His heart rate is a little elevated, but he's anxious as well. So I'm not too concerned about that at this time. We just need to keep him calm and get him to the hospital where he can be properly assessed by a physician. Hey, Rosie. Rosie Rose. I got a little poodle named Yoda. Hey, Rosie. In a way, the dog is actually, you know, helping me do my job. She seems to be a calming mechanism for him in this hectic situation that he's got going on. To ease your mind a little bit, all your vitals are checking out great, okay? So your heart's beating a little fast, it's like 140, but you just got stabbed with an umbrella and all this is going on, you know, I'd be anxious too.
I got a call at the 8th District Station. Someone from your scene bit by a dog and requested EMS to check him out.
I'm en route. We are headed back into the French Quarter. I'm going to the police station for a male that was bit by a dog. I'm thinking maybe the dog that bit this guy who stabbed his owner. So that would be wild, but my ESPN is telling me, you know, that that's what's going on. You know what I'm saying?
Dog bites can be brutal. Not only are they penetrating, but they can also grab so much muscle and tissue, and they can actually rip that, you know, right off the bone. So that's one of those ones where you don't know what to expect.
This is it, dog bite.
He's inside.
6249 on scene. Is this the perpetrator from the 34C?
This is the perpetrator.
So he got bit by Rosie.
Dan got bit by a dog.
Hi, where'd you get bit at?
On my legs.
On your legs? Can I see?
For sure.
Yeah, I can open it. So where'd you get bit?
On my legs, right here by my knee, or by my calf, or my ankle, and then on this side.
Just this one right here that you can feel?
On this side by my calf, up towards the knee about halfway, right there on the right side.
Okay, yeah, you got a couple little nips.
I can definitely see, you know, a few little nips, but no real penetrating bite marks. There's no, you know, bleeding. There's nothing that's gonna require stitches or anything like that. So he's in pretty good shape.
Okay, do you wanna go to the hospital?
If I'm going to drill, if they can fix this up at the drill, then like just take me in the drill.
I mean, I'm not seeing anything that needs stitches. Of course, you can always get like a tetanus shot. Do you know when your last tetanus was?
I'm up to date on my tetanus.
You're up to date on your tetanus. Okay, you don't have to go to the hospital if you don't feel like you need to.
He may need some shots, he may need some antibiotics, you know, he could definitely use like a good scrubbing to this. But other than that, you know, there's no real significant treatment that he needs. I think this is something he could definitely take care of on his own.
No, I don't want that dog to be put down.
No, okay.
I don't know if I have any control over that, but I really, the dog's a good dog. It just has the on it.
Okay. All right, well, he doesn't have anything that needs stitches. It's all like nips and swelling and stuff like that, but he doesn't want to go to the hospital.
Okay.
All right, and if you guys need us, just call us back, all right?
All right, thank you.
Good deal. Y'all be careful.
The dog, being protective of his owner, nipped this guy a couple of good times. And that dog could have done a lot more damage than what he did.
6249, clear with a patient refusal.
But I can't imagine, like, you know, being a tourist, like, on Bourbon Street and just seeing, like, two people fight and somebody gets stabbed with an umbrella and somebody gets attacked by a dog. You know, like, that's wild. That's, you know, that's New Orleans.
Whew. My gut never steers me wrong.
Rescue 5, we have a 9-year-old boy with respiratory issues and possible asthma attack. Please acknowledge.
Was it difficulty breathing with a history of asthma? We're not 100% sure if it is an asthma attack or what. The Jayhawk. Oh yeah, the Jayhawk. Where they have color TV and they got free adult movies. Taking my wife there for our anniversary.
Oh wow, special.
I just wanted to feel like all the amenities were already broken in.
Definitely be broken in along with your car.
Now we're talking. Oh, there, right there.
He does not look good.
As we arrive on scene, I can see a 9-year-old boy. He's coughing uncontrollably. As a father, it's tough to go to calls involving kids.
He had some allergy medicine.
How long now? David, through all that cough. 2
About
hours?
2.5 hours now. Non-stop. Like he hasn't stopped.
You take a prednisone too, they said.
It's supposed to be to stop this, but when we give it to him, it makes it work.
Prednisone is a steroid that helps to treat the inflammation associated with asthma. Right now, we're not really sure why his condition worsened after taking prednisone.
Let's get him on a stretcher, guys. Are you riding with us?
I am, yeah.
Put some seatbelts on you, okay?
Attaboy.
You want IV?
Yeah.
What's your arm, buddy? All right, buddy, I gotta flick your arm real fast, okay?
No.
It's like a little pinprick.
Don't look. Look over here.
Just don't look.
No.
It's really important to have a steady hand and also be confident in your IV site. You want to get this over as fast as possible to make this as painless and quick for this little kid.
Grandma, it's okay, baby.
What's out, buddy? The needle's out.
Listen to her. It's okay.
All right, everybody out, let's go. When his grandmother couldn't calm him down, I had to clear the truck and just get one-on-one with him. So he had some time to just relax and calm down. Try to control your breathing in through your nose, like you're smelling the roses, and then blow out the candles. Smell the roses, blow out the candles. And that's all I want you to think about right now, okay? Try to calm your thoughts and just relax. Now listen, all we're gonna do now is just take a ride, okay? You can be brave, you can be strong. All right, man, you got nothing to worry about, Bubba. Me and him, we got you, all right?
Just a little car ride, okay?
Just a car ride, that's it. You're all done. No more poking, no more prodding. Feeling better? Attaboy.
How'd you stop coughing?
We got it all under control. We're gonna smell the roses and blow out the candles.
Literally coughed nonstop, no break for two and a half hours.
It's a long time. Does he have anything going on in his life right now, stress-wise?
Oh, yeah, there's a lot of stress.
Yeah. That can trigger it too, Mom.
Yeah.
You got him nice and calm. His breathing's improved. He's setting at 100%. You're a big guy, man, all right? You did good, buddy. You did good. You get to ride in style tonight. There's a guy that I used to work with on the job here. I heard him use that term, smell the roses, blow out the candles.
Not only did it work, but it worked in like record time, you know? It was like almost instant.
I think with kids, I think especially as patients, they need to know that they can trust us. And he started to do it. The rest of the ride there, he was Joe, man.
City of New Orleans 911, what's your emergency?
Our Uber driver was just dropping us off, and as soon as we all got into the house, someone hit her over the head and just drove off.
All right, ma'am, we're sending police and EMS, okay?
We are going to a 74-year-old female. The complaint's gonna be an assault. It says here, I was thrown from a moving vehicle, and now I have bleeding from the head. Oh man, that sucks.
I hope it's not a carjacking, bro. Hopefully it's not nothing too stupid like that.
Yeah. All right. So let's say I'm a genie, and I'm like, poof, you can speak any language, but let me give you another option. You can keep your language, or you could talk to animals. Which one would you pick?
Keep my language.
Languages? I'd go for animals, man.
Like Dr. Doolittle? No.
Oh, man. I just wish I was able to text my dog.
What are you gonna tell you? I peed on your carpet.
Yeah.
You know what I'm saying?
Oh, man.
What's up on the front? Show us on scene on desire. Hello, how you doing? What's going on?
A big driver dropped us off, and somebody stole her car.
Ma'am, what's your first name?
Fanny.
Okay, Miss Fanny. Besides your head, does anything else hurt?
Sore.
Okay. Did you get knocked out?
No, I fell. I hit on the ground.
Okay.
A little bit dizzy.
Okay. Well, let's make our way to the ambulance and take some vital signs, okay?
They don't have a key for my car, so.
It's okay.
You cannot start a key.
Well, you can't start the car either. It's gone.
Yeah. What do you get my car back?
Yeah, I hope so. We can obviously see that she has a traumatic injury to the head, and it seems like a pretty significant laceration to her forehead. Go ahead and have a seat. And can you throw your legs up for me?
Right here?
Yes, ma'am.
Okay.
So we know for sure she was drug out, thrown.
Yeah, she was half in the car,
half out the car.
Okay. So she was kind of drug behind and then fell.
I got you. Miss Fanny, I'm gonna put something to cover that up, all right, bro?
This patient has a pretty significant laceration to the head. Though we have bleeding controlled at this time and she does have a good mental status, we want to make sure that doesn't change because there could be other injuries, possibly any bleeding on the brain.
I'm sorry this happened to you.
I'm sorry, too.
Where are you from?
MIT.
Oh, really?
Made in Taiwan.
Oh, you got
I
me.
see.
See, I'm thinking about the Massachusetts Institute.
I came here in 1978.
Oh, okay.
Immigrant to here.
Can I ask a question? Y'all got good food over there?
Oh, yeah.
Yeah? Better than down here?
Of course.
Of course.
Oh,
I don't
Haitian's
know about
definitely
that,
confused.
Yeah, I don't
Whew,
know.
now I'm
We gotta
worried.
put that to the test.
Mm-hmm.
All right, we're gonna get y'all up to the hospital, all right, sweetheart?
Okay. You'll be able to get my call back? Can you catch
throw
that
on the computer?
sucker?
You said you want to catch the suckers?
No more breathing, huh?
No more, okay?
I'm pretty healthy, though.
Yes, ma'am. I would say for someone, given your current circumstances and your age, you're doing pretty well. I'm proud of you.
Yeah, thank you.
Mm-hmm.
This patient's gonna get a CT scan at the hospital. This is gonna rule out any further injury or any bleeding in the head. I really hope this lady is able to recover well, maybe a few stitches, and continue her life and get her car back.
My brain is okay, huh?
It seems to be okay for now.
Right now. We never know later on.
You're looking pretty good.
Rescue 5, mother reporting small child not responsive. Child is conscious but not reacting.
It's a 7-year-old male, possible seizure.
Febrile seizures?
Seizures can be dangerous, especially where it's caused by fever in kids. Sometimes patients will actually seize to the point where they stop breathing. Anytime you see a kid in distress, it always touches home, especially when you have kids of your own. Is this it right here? Yep, apparently. What's going on, y'all?
I think you have the seizure.
Seizing right now?
Yeah.
Hey, buddy. Can you talk to me? The fact that he's in this catatonic state is a sign that he did, in fact, have a true seizure. How long's he been like this for?
I didn't notice until we was getting out of the car.
Has he had seizures before?
Last week he had 2 of them.
Was he like it is now? He's just staring off?
You know, one time he was like pent up.
Okay. Mom tells us that this patient's had 3 seizures in 2 weeks. We're concerned because if he's had one, he could possibly have another one. It's when they have multiple seizures back to back. That's really when you need to be concerned. Hey, buddy.
What's going on? Talk to me?
Feels pretty hot. It's only 98.4. It feels pretty warm.
Let's see what the glucose looks like. We're looking at all of his vital signs. It's possible that it's his blood sugar that could be off. That may cause him to have the seizure.
Buddy, let's check your blood sugar.
Not a flinch at all. 166. His blood sugar is just above a normal range, so I don't think that's the underlying cause as to why he's had the seizure.
I'm gonna get you out. You all right? You okay?
Let's see what he does with the IV and see what kind of response we get. I need to get an IV line in so that in the event that he does need medication, I'll have the ability to give it to him. That was the response I was hoping for. I hate hearing this little boy cry, but hearing this reaction is kind of a sigh of relief because I know he's responding to our stimuli and he's actually responsive.
You're good, buddy. Took it like a champ. Good job. You feel sick? Yeah? Your stomach hurt? No, what hurts? Your head? Does it hurt up here? Is that the only thing that hurts?
Well, he's not febrile, and so far all of his vital signs look good, so get him checked out.
I'll put some safety belts on you, okay? If you're safe, your mom's right there. Took it better than a lot of adults do. Rescue 5, we transport St. Joe's.
St. Paul Bridge westbound, St. Paul Bridge westbound. For a bicyclist struck.
The exact location of the vehicle is not given.
4-wheeler.
Male lying on the bridge. We don't know the age of this person.
Keely went en route. She's floating.
Okay.
All right, so we got a call for a bicyclist struck by a white vehicle.
And NOPD is on scene, and I think Lori and Katie are coming.
All right, it looks like it might be on the other side now.
I see flashies up there.
Okay.
Well, that's a bunch of damage from a vehicle. That's a bunch of car parts.
Well, that's just all kind of messy. Okay, this guy is laying down over here.
Hey, so what happened, love?
Don't mind him, and she was trying to kill me.
She was trying to kill you, so you know who did it?
She ran. No, I don't know.
Okay. You were walking, what were you doing?
On a bike.
On a bike? Where's the bike?
No.
How fast was the guy going? Does he have any idea?
Witnesses said about 20 miles an hour at the point of impact, but they said they drug him a little bit too.
Did the car stop?
No, the
No,
car's
the car
gone.
cap, there's all kind of debris on the
Yeah, the car.
the grate over
the
there.
car didn't go far past the bridge because this whole lane is full of car debris.
When I get on scene, Lori and Arcadia already performed patient care along with the fire department. They have already confirmed that it was in fact a bicyclist that had been struck. It's not uncommon for us, especially on that bridge, because there is a shared lane, and I think a lot of motorists don't understand that.
Any of this hurting you?
No.
No? Okay. That ankle, obviously. What else? That's it? Okay. This one's not broken. This is just a lack.
No, the right one's broke for sure.
All right, love, can you feel me touching?
Yeah.
Can you wiggle? Good job. All right.
He probably was hit and drugged, if not thrown, by this vehicle. This fire department already has a C-collar in place and is holding manual C-spine. My patient has a large laceration to one foot, and that has an open break to the other. I want to stabilize that, get a splint on it before we start moving him and put him on the stretcher.
All right, baby. Gonna suck.
Somebody grab his leg. Grab
Control
that
that leg.
1, 2, 3.
With the amount of crepitus that I'm feeling in his ankle, there are multiple breaks in there, and he's definitely going to require some sort of surgery to put this back together.
You cool? I'm gonna get you covered,
We're gonna
baby.
get you covered up
I'm
in
just
one
trying
second,
to find
my
all
baby.
your bobos, okay? Yeah, here.
A lot of road rash. Laura, you want to do the IV over there?
Well, yeah.
Because like I said, he's got a lot of road rash over here. I'll cut for you.
All right, let me see this arm a minute, my baby.
Nothing up here hurts, huh, baby?
Did you get knocked out, or were you awake the whole time, baby?
No, I was awake the whole time.
Awake the whole time? Okay.
The car rolled completely over, and they said people driving cars are too consumed with doing everything inside of their car except driving and paying attention to the road and people around them. He is very fortunate. I wouldn't ride a bike in this city. Walking's dangerous enough.
I'm gonna get you pain meds, baby, okay?
All right, you ready?
Yep.
You good, Katie? All right, baby.
Put me en route to university on a trauma activation.
All right, I'm gonna get this in your nose, and then I'm gonna get that pain medicine for you, okay? Yeah, I know, baby. That's all I'm really concerned about. You got some, like, bad, like, road rash on your arms and a couple other places. That one leg is broken, and it's gonna be broken in a couple different pieces. It feels like Rice Krispies in your leg, okay? But the fact that you can still wiggle, I can still feel a pulse, is all great, okay?
Even though the patient is awake and talking and breathing, he has been hit by a car. So I need to get him to a trauma center where they can scan him, see what's going on inside his body, and see what injuries he has that aren't visible to me.
How's that pain, baby? 4 or 5? All right, I'll take that. What was it before? About a 10? Beautiful.
Dude, I was still new from being in this passenger seat, dude, because it's different. I mean, you know it's different now.
Oh, yeah, it is. It's different coming over here. And it's kind of weird because I don't really like people driving.
Right.
I'd rather drive myself.
Right.
You know, being in Iraq, getting blown up and stuff.
Right.
So I have kind of anxiety when someone else is driving me.
Right.
I got to trust them, you know what I mean?
Dude, that would probably freak me out, man. Especially like if you driving and the truck in front you just blow up.
Oh, it's crazy.
After being in the military 12 years, there's not much that the city of New Orleans can throw at me that I can't handle. And being in the military, there's a lot of parallels with being in New Orleans EMS. It's a sense of duty. It's a sense of you're going to be there for someone. And I feel a sense of pride being ex-military and now serving my community as a paramedic.
Hey, look, turn around.
Why?
Dude just passed out in the middle of the gas station. You see him on the ground by the air machine?
Oh, yeah.
This dude knocked out.
Your item number 3 there.
Let's see if we can get him up. We just see this brother just laying in the middle of the parking lot. And the first thing I'm thinking right now is that this patient overdosed. But he's in a gas station, so you have cars coming in and out. So the main thing is that we need to get him up before a car run over him. Yo, what's up, man? You all right? Yeah. You gotta get up, bro. You passed out in the middle of the street. Oh, I know. I'll grab your money, bro. You all right?
Yeah, I'm all right, man.
Then why you laying in the middle of the ground?
Oh, no, I ain't been getting no sleep, man.
Yeah, so you want to sleep right here in the middle?
Kevin, let's get you up, my man.
You gonna get
Come
up?
on.
Get up right, bro.
Let's get you right.
There you go, brother.
You want to go to the hospital?
All right.
Hey, look, you want a mask or you all right?
I do need a mask.
I'm gonna grab you a mask right quick. He seems a little groggy, but he's been sleeping, so that's natural, so we're not too concerned about that. He knows where he's at. He's answering everything appropriately. The brother just took him a little nap. He took it in the wrong place where he got hit by a car, but at least we know that he's all right. Hey, look, you gonna be Gucci?
Yeah, baby.
All right, look. Don't be spread out no more, right? We gonna...
Yeah.
I was laying.
Man, you were
out there like that.
right in the middle, right here.
Tell you.
I would look like I was on a cross.
Yeah, like you laid out. All right, look, you stay up, bro. I'm gonna get up with you later, all right? Holla at your boys, dog, for sure.
Man, dude.
Let's go.
I'm headed uptown for a 2-year-old with a bead stuck in his nose. This is a very common pediatric call. This is the perfect age where exploration is everything, and they like to shove stuff in their noses. 6249, I'm on scene. Hi, how are you? What's going on, Mama?
My 2-year-old, he's complaining that his nose is hurting. So I look in his nose, he got beads, like bracelet beads. I ended up getting one out, but then when I look back with the flashlight, there's one like way back there.
Let me see.
It's this side.
It's so hard to see. It's pink.
Mm-hmm.
Let me see something. You feel that?
It's deep down, because I took one out.
Is that even a bead? Or is that just his nose? Actually.
It is.
But it's way back here to the point where you can't even
get it out.
You can't even feel it, yeah. Why you did that? Can you blow your nose? Can you blow real hard?
Can you blow your nose?
Do it, real hard.
Blow.
Blow. Do it again. Big one. Nothing but boogers. At this point, my only other options to keep him from being transported is to try and use suction. I don't have suction. So at this point, I have to call an ambulance, which is good because, you know, I can use their suction, and if it comes out, then great, and if not, then they can take him to the hospital where they'll get it out.
Oh,
Look at you! He's just like every other little boy. He played shy for about 2 minutes, and then we were home free after that. You ready? Let's go see if we can suck this thing out. Hi, Perez. All right, buddy. The problem is the bead is like to the left.
That's the bead? That's not his turbinate?
At least I think, Mama, the beads were pink, right?
Yeah, they were pink.
I would say that's his turbinates.
Yeah, now that you got the light right there and he's laying straight back, maybe he doesn't have any more in there. Can you breathe?
Yeah.
Breathe. Breathe out of your nose. Close your mouth. Breathe. Mama, that looks like his nose now that we're...
You want to see
yeah,
Mom?
let Mama see it.
See that little pink?
Yeah. I don't know. Yeah, that kind of look like something.
Because look on this side, and it's the same, kind of a similar color.
Let me see. Yep. Yeah.
Yeah, now that we got good light. No, that's all right because it looked like it to me too.
Yeah.
Do you want to take him just to be safe or you want him to stay home?
We'll y'all think? Think something in there?
Do you feel like it's stuck in there?
You got something in your nose, True?
Do you feel like it's in there? No? I mean, you can always watch him. You can follow up with your pediatrician.
Yeah, I will.
All right. Once we get him into the ambulance and we're able to look at both sides in really good light, there's no beat in there. So, you know, I essentially just got a play date. And that was fantastic. All right, come on. We were just kidding. Let's go inside. You ready? Let's go. All right, my man. It's always the boys that stick beads in their nose. Little girls don't even do that with their own beads. Little boys always do. Hopefully I don't catch you no more. Bye, True. Man, I thought that was a bead though. I got played. Now he gets to stay home and possibly shove more beads in his cute little nose.
Be safe, be strong. Let's do this.
Get that stretcher in here.
You're gonna bleed to death.
Grab the nozzle, grab the nozzle.
You know, they're not dead. I can work with that.